When your appointment is booked for day surgery, we will ask you to observe social distancing from anyone not in your household for 14 days before your procedure. 3 days before you come in, you must self-isolate, including staying 1 metre away from anyone not in your immediate household and only leaving your home in the event of your own medical emergency. If you develop any symptoms of COVID-19, high temperature, cough, loss of taste or smell, please get in touch with us before you come in. You may need to have a test to confirm that you don't have COVID-19. Your friend or family member can come with you up to the main entrance of the building, but will not be allowed in. But if you need help getting to the door and from the door onwards, we will be able to help you, and one of our staff members or volunteers will meet you at the door and check that you have an appointment scheduled. The Birmingham Treatment Centre is completely separate from the rest of the hospital and does not treat patients with COVID-19. We check everyone who enters the building for COVID symptoms to ensure we keep everyone safe. On entrance, you will be asked to use hand gel. We will check your temperature and ask you to put on a new surgical mask, which we will give you. Whilst you are in the building, you need to observe social distancing by staying at least 2 metres apart from others. For your stay with us, you will be shown to your own separate bed space to maintain social distancing. Your safety is our primary concern, so we will do a number of checks to confirm your identity and what procedure you are due to have before we book you into the ward.
Toilets are allocated just out here on the right hand side. Gown is just at the bottom of the bed here. You want to pop your gown on?
When you are prepared, a theatre practitioner will come to collect you and will ask you to confirm your full name and date of birth. They will also ask you to confirm your signature and that you have given consent for the procedure. The theatre practitioners will be wearing personal protective equipment. They will ask you to get onto the theatre trolley in your bed space and will cover you with a sheet.
I'm just going to pop the sides up as well. All ready? Yeah.
They will then wheel you the short distance into theatre.
Hello Annie, I'm Tyra, one of the practitioners here. I'm just going to ask you some questions you've been asked millions of times before.
When you enter theatre, your surgeon or theatre practitioner will ask you to confirm your name and date of birth and will check the details on your wristband. They will also check what procedure you are having and, if appropriate, which side it will be on.
And can you just confirm what operation you haven't done?
The theatre practitioner will ask you to remove your glasses and your surgical mask. The theatre environment is designed with safety in mind, so there is lots of equipment to monitor you whilst you undergo your procedure. The anaesthetist will pop an oxygen mask on you and you will very quickly fall asleep.
Hello Annie.
A post-operative nurse will greet you as you wake up after your operation. She will ask you how you are feeling and will check to ensure you are recovering well. You may feel a little dizzy or disorientated, but this will soon pass.
A bit dizzy. Yeah, you will be for a little while.
Hi Annie, how are you feeling?
You will be offered something to eat and drink and encouraged to go to the toilet. After you feel better, a nurse will come to check to see if you are ready for discharge. She will take another set of observations to ensure your vital signs are normal and you are ready for discharge. If she is satisfied you are recovering well, she will explain your discharge paperwork and will bring you a new surgical mask for your discharge.
We can take you downstairs, escort you to go meet the family for home. Shortly I'm going to shut the curtains if you want to get yourself changed.
Hi Annie, your friend is downstairs, so I'm going to take you down.
A healthcare assistant will come and collect you to escort you downstairs to meet your friend or family member who will take you home. Once you have left the post-op ward, your bed space will be thoroughly cleaned and made up with fresh linen in readiness for the next patient. Before you leave the building, you will be asked to use hand gel. Your friend or family member can meet you outside, but they will not be allowed to wait inside the building, as we put patient safety first, so are strictly limiting access to our buildings. However, if you need assistance, one of our staff or volunteers will help you outside into the care of your friend or family member.